So good morning and welcome to the first annual Equity and Economic Empowerment Health Expo.
A lot of vendors, a lot of interest. Talk about this event.
Yes, it's finally here. It's been about 6 months undertaking. We've partnered with health and financial partners to really address barriers in the community to access when it comes to your health access and also access to financial opportunities, especially within generational wealth.
I'm honored to see such a diverse gathering here today, all united in our shared commitment to creating a more equitable California for all.
Across a diverse community, barriers do exist and hinder individuals from accessing essential financial resources and opportunity.
I've had colleagues say to me, "Why are you wasting time with those folks? They don't get it." And I said, well, if somebody doesn't help them, they'll never get it.
Yeah.
There's some excellent opportunities in insurance and annuities, just things people have never been educated about. Seek out an advisor. You're welcome to call me.
Safety staff will be at the front. Feel free to take pictures with them.
Well, we're from the California Office of Traffic Safety, and we're encouraging people to go safely. But there's a lot of grant opportunities that the California Office of Traffic Safety does provide, and it's a great educational experience for people to learn and understand that there are outlets that do provide resources. So if someone needs a helmet, we can help provide that to you, or maybe more CHP that's needed in your area. We can help with that.
Here at Caltrans, especially in Caltrans in the Equity and Programs Office, mental health is a commitment for us. It's not a space to check the box.
So I think in many of our communities, especially our communities of color, there's often stigma around mental health disease. One big myth is that people with mental health conditions are not strong enough. So there's this idea that if you just keep pushing, you're gonna get through it. This is not a failure of your strength. It's not a failure of your willpower. This is disease, like any other disease.
So at Jamir Health, we actually offer free services, medical services, to those who do not have health insurance. And that's through our mobile health clinic. And specifically for those folks who are underserved, we're talking about the BIPOC community who are underrepresented and don't necessarily feel like they have that safe space to access health care. Go to the Mobile Health Association. There's a website and there's a map. And so what you can do is you can look at across the United States where there are mobile health clinic programs. There are programs that do mammography, ophthalmology, eye care, that are responsible for dentistry as well. So not just medical services, but really everything.
We are increasing our bike lanes in Oakland, reducing our carbon footprint. So for folks to be able to come out and get helmets is also powerful. It's not often that you can do a one-stop for equity, and for our citizens to be able to come here and get the health screenings is so powerful because we know the value of preventative care.
I just saw something on TikTok the other day that was shared with me where someone's saying, you go into that doctor's office and you fight. I hope that soon we don't have to fight.
Let us remind ourselves that by working together, we have the power to break down barriers and to build a healthier and more prosperous tomorrow.
The other thing is we have to educate them and educate them while they're young because they are a clean slate. They don't know the negatives. Teach them the positives. Teach them that I'm growing this tree so you can sit under the shade in the future. You keep the tree alive so that your kids can sit under the tree, and teach them to do that for generations and generations and generations to come.